The silent risk, optimizing sleep hemodynamics for stroke prevention, why the mechanics of sleep position become a primary health factor after age 60. This guide utilizes a diagnostic and prescriptive approach to identify the silent mechanical threats occurring during sleep and provides the clinical gold standards for mitigation. The nighttime paradox. Sleep as a physiological stress test. Night and early morning 1 in 3 strokes occur during sleep or shortly after waking. The misconception: we view sleep as recovery. But for the aging cardiovascular system, it is a period of vulnerability rooted in mechanics: blood viscosity, gravity, and pressure. Clinical note: 68-year-old active patient, normal cholesterol, suffered waking stroke due to sleep position compounding. You cannot control the exact moment a stroke occurs, but you can control the hemodynamic environment in which you sleep. Why age changes the rules of circulation. Younger physiology, aging physiology, high adaptability. The 3 biological shifts. 1. Viscosity. Blood naturally thickens at night due to mild dehydration and stasis. Low tolerance to compression. 2. Vessel rigidity. Arteries become stiffer. Reflexes to correct pressure changes slow down. 3. Anatomical fragility. Minor compressions, neck, heart, can trigger arrhythmias or clots. Key takeaway: after age 60, homeostatic defenses weaken, making static posture a critical variable. Risk audit. Number 1. The flat back trap. Pooling the habit. Sleeping completely horizontal, supine, without elevation. Mechanism of injury: when head level equals heart level, blood pools toward the cranium, increasing intracranial pressure. ICP. Consequence: strains microvessels in eyes and brain, reduces oxygen flow. Gravity fails to assist venous return. Red flags: morning headaches, dizziness, blurred vision, signs of microbleeds or TIA. Risk audit. Number 2. The right side compromised. The habit: sleeping on the right side. Risk for cardiac patients. Mechanism of injury: IVC compression. The major vein returning blood to the heart is compressed by body weight. Cardiac position: gravity presses the heart against the chest wall, restricting movement. Consequence: heart works harder to pump, reduced efficiency, risk of arrhythmias. Inferior vena cava. IVC. Key takeaway: right side sleeping can significantly impair venous return and increase cardiac workload, particularly for those with pre-existing heart conditions. Risk audit. Number 3. The pillow stack misalignment. Kinked vertebral artery. Kinked garden hose. The habit: using multiple or overly high pillows. Mechanism: hyperflexion. This unnatural angle compresses vertebral arteries feeding the brainstem. Consequence: reduced blood flow to critical brain centers. Tension headaches. Mini stroke vulnerability. Risk audit. Number 4. The tight fetal constriction restriction. The habit: curling the body tightly, knees to chest. Mechanism: consequence result: diaphragm compression prevents full lung expansion. Prolonged muscle tension restricts cervical vessels. Shallow breathing: reduced oxygen saturation. Cardiovascular stress in a hypoxic, low oxygen environment. Risk audit. Number 5. Metabolic disruptors. Dinner: finish 3 hours before bed. Alcohol: stop 5 hours before bed. Sleep onset food mechanism: digestion diverts blood volume to the gut. Splanchnic circulation, leaving less reserved for the brain. Alcohol mechanism: vasodilation causes pressure drops, followed by compensatory spikes and unpredictable swings. Protocol activity: a 15 to 20 minute light walk after dinner regulates glucose in circulation. The protocol: moving from habits to optimization. Resistance: working against gravity. Flow: working with gravity. We do not seek to just avoid harm, we seek to optimize the body's nighttime maintenance systems. The goal: establish a posture that assists the heart, clears the brain, and neutralizing gravity. Prescription A: left side sleeping. The gold standard: glymphatic clearance. Inferior vena cava clear and open, prevents acid reflux. Why it works: hemodynamics unblocks the IVC. Gravity aids heart pumping. Implementation: brain hygiene optimizes the glymphatic system to clear amyloid beta. Digestion mechanically prevents acid reflux. GERD: waste proteins. Use a body pillow to maintain neutral spine and prevent rolling. Prescription B: supine with elevation. The alternative: 15 to 30 degrees elevation. Target profile: for those with shoulder pain or arthritis who cannot side sleep. The 0G effect: lowers intracranial pressure, facilitates venous return from legs, opens airway, reduces snoring apnea, prevents blood pooling. Stroke-proofing the environment. 18 to 20 degrees Celsius thermal regulation. 18 to 20 degrees Celsius lowers core temp and blood pressure. Light control. No blue light after 9 p.m. Protects deep sleep phases for plaque clearance. Auditory control. Eliminate sudden noises to prevent cortisol microspikes. Support. Cervical memory foam to maintain neck curve. Monitoring the silent signals. Subjective tracking. The journal. Note morning symptoms immediately upon waking. Brain fog, headache, numbness, dizziness. Objective tracking. The tech. Pulse oximeter. SP02. Checked for overnight oxygen drops. Heart rate variability. HRV. Low overnight HRV indicates autonomic stress. If these metrics are off, adjust position and retest. Summary. Awareness is the prescription. Avoid adopt compression, right side fetal, pressure, flat back, misalignment, high pillows, left side, circulation plus brain cleaning, elevated back, airway plus venous return. You do not need a prescription to lower your stroke risk tonight. You need only to adjust your position. One small mechanical change protects your brain for years to come. Please subscribe to help the channel and don't forget to like. Thank you.